Now, where the Joint United Nations program on HIV and AIDS, UNAIDS, is briefing the media on a breakthrough pricing agreement for HIV medicine, and Health Minister Aaron Motsoaledi is currently addressing the attendees.
Constrained environment that we have to provide health services, we are always searching for ways to decrease input costs and make our services more efficient and affordable. I'm sure many know that South Africa has got 3.9 million people on ARVs. And this is the biggest program ever in the whole world. And the majority of these people are treated by the public sector. The private sector only accounts for 260,000 out of these 3.9 million. So given our commitment to reach the 1990 targets, which means nearly doubling the number of HIV-positive patients on treatment, that means we are targeting 6 million people on treatment in South Africa alone by the year 2022. We have to significantly increase the number initiated on treatment each year, starting now. This means either finding additional funding or decreasing input costs, or a combination of these two. I am informed that using dolutegravir in a fixed dose combination will give patients as well as the public sector significant benefits. For the patients, dolutegravir is a more effective ARV with fewer side effects than the drug that it replaces. That means efavirenz. It is better tolerated, which means better adherence. In addition, research suggests that it is more robust and will decrease drug resistance. I'm just from a session with Dame Dali Davis on antimicrobial resistance, and the figures mentioned there about what will happen if we don't deal with antimicrobial resistance were quite disturbing. And now to have a new drug that will reduce and decrease that resistance is quite phenomenal. So the new fixed dose combination is therefore tenofovir, lamivudine, and dolutegravir, which is abbreviated as TLD. The benefit for the public sector in South Africa of this new combination is that we estimate that we'll have significant savings because of the lower price compared to the current FDC, the current fixed dose combination. We estimate that over the next 6 years, South Africa will potentially save up to $900 million. This is a huge saving. In South African rands, I've calculated that it means a saving was about 11 billion South African rands over the next 6 years. It is very critical in today's financially constrained environment. I think that it's important that we know that dolutegravir is not a new drug, but it has been widely used in countries that could afford its high cost. However, low and middle income countries such as mine were not able to afford the cost of this drug. However, with the support of the Gates Foundation, as well as the Clinton Health Access Initiative, working with a range of generic manufacturers, we are now able to decrease the cost of the FDC, and therefore we are able to include it as part of our new treatment regimen for HIV. This shows the power of global partnership. As we move towards the implementation of universal health coverage and full implementation of the SDGs, we must be able to work together. The spiraling cost of healthcare provision in every country in the world needs to be addressed, and we can only address this in ways that increase equity in access to services based on need and not on ability to pay. If this is to work, South Africa will include this new FDC in our next open tender with the aim of providing the new combination around April 2018. We are therefore very pleased to be part of the process that resulted in this announcement today. These new prices will help many countries to move more rapidly to this new combination of ARVs thus improving the quality of HIV treatment for our patients. In conclusion, I wish to sincerely thank our partners in this agreement, including the government of Kenya, the Bill and Melinda Gates Foundation, and the Clinton Health Access Initiative for making this pricing agreement possible. Thank you.
Thank you, Dr. Motsoaledi. We'll now hand over to Dame Sally Davis.
I thought I'll get a standing ovation. This announcement. I'm not getting
You
it.
deserve one. You deserve one. Honourable Minister, distinguished delegates and media correspondents, follow that. But I am delighted to be here today because we can celebrate extraordinary progress over the last decade. We've seen AIDS-related deaths cut by half since 2005, and we're seeing a downward trend in new HIV infections, particularly in Eastern and Southern Africa, where HIV infections that are new have fallen by a third in just 6 years. And this year, for the first time in history, more than half of all people living with HIV now have access to HIV treatment. But today is another historic milestone in our fight against this horrible, deadly disease. The Minister pronounces it beautifully, but I'm going to call it DTG, is a superior HIV treatment. It's the best in class. It's more effective, it has fewer side effects, it's less prone to resistance, and as you heard, I have a particular interest in how resistance to drugs and drug-resistant infections cause unnecessary suffering and deaths from many diseases, and HIV is what we're talking about now, but many. It's terribly important that this is less prone to resistance. And now, thanks to this landmark price deal, it's cheaper. So we can go wider and faster, because it's one thing having innovation, very important, and DTG available in rich countries, but actually we need always to scale up. That's the essential bit to saving lives, and that needs a price that is affordable. So we can reach more people with the new and improved medicines and make all our taxpayers, whether it's British, South African, Kenyan, money go much further. I want to put on record I am proud of the role the UK has played in this groundbreaking partnership. Viv Healthcare, which is the GSK's HIV health subsidiary, is a UK company, and it developed this new medicine. And they were very willing to partner so it could be made available quickly to the world's poorest people. With support from our aid department, the Department for International Development, the Clinton Health Access Initiative, CHAI has led the work on DTG since day one, and I'm very proud to have recently joined the board of CHAI and to have heard about this in its final stages. CHAI has supported the market entry of the generic manufacturers, Aurobindo and Mylan, into the market, so that can underpin this announcement today. So, now, with support of UK funding, UNAIDS is joining with government, civil society and downstream partners to drive uptake in key target countries and prepare national health systems for that sustainable scaling up that is going to be so essential. Finally, I want to thank all the partners, just as the Minister has, who contributed to this momentous milestone. Particularly, of course, the governments of South Africa and Kenya. Your visionary political leadership, this is the standing ovation for you, and commitments to scaling up the new treatment in your own countries, but also the technical agencies and donors that have collaborated, and, of course, the role of civil society. Civil society's tireless campaigning has really pushed donors and keeps our government and others moving quickly on HIV, making sure that DTG is there for the people who need it. So we have a day of celebration. But there are challenges ahead. We've got to step up our efforts to reach the ambitious targets we're all committed to. We have to finish the job we've started. And we, from the UK, stand ready to play our part. Thank you.
Thank you very much, Dame Sally. We shall now hand over to the Executive Director of UNAIDS, Mr. Maan Mora.
Not very much to add. I have the privilege of being here next to Sally and Minister Motsoaledi. I think this is a great example of the complexity and the importance of bringing innovation to the response. It took us more than 10 years to transit the efavirenz, the current treatment, from the rich countries to the downstream, to the field. And now we are bringing DTG in less than 3 years, which is a record time. And this is the result of a great partnership between a number of actors. This is not a unidimensional type of work. This is the result of government and political leadership, industry, working with bilateral organizations like USAID, PEPFAR, and multilateral organizations like UNAIDS and the Global Fund, and the leadership and the regulatory function of WHO at the headquarters, regional and country level. Civil society, great role pushing us all to be bold, to take more risks, and to be more intelligent in bringing innovation to the response. So I joined here these great talents together, and we are very proud to be part of this amazing consortium and this incredible initiative. So thank you very much.
Thank you very much, Mr. Maan Mora. I'll now ask Dr. Marashi from the World Health Organization to come to the lectern and deliver his remarks.
Thank you. Good morning. The World Health Organization welcomes this agreement. It's a true milestone in our collective effort to end AIDS as a public health problem by 2030. 2 months ago, it seems unimaginable. WHO has been recommending dolutegravir as an alternative first-line treatment since 2016. We could see it as one of the best available options to improve treatment adherence, suppress viral load, and combat the growing threat of HIV drug resistance. WHO also provided guidance and will work closely with countries on how best to transition to this DTG-based regimens based on the reviewing experiences of some 20 countries who were already moving in this direction. But it was still too expensive to be really viable. This new agreement means countries can now move forward full speed to implement this transition. Our sincerest congratulations and thanks to all partners for their commitment and efforts, and WHO look forward to our continued collaboration as we move forward. Thank you.
I believe
those were live visuals from the UN, where the Joint United Nations Programme on HIV and AIDS, or UNAIDS, just briefed the media on a breakthrough pricing agreement for HIV treatment. Health Minister Aaron Motsoaledi was addressing the attendees there first. He said having a new drug that will deal with the resistant HIV and its symptoms is quite a milestone. He said within the next 6 years, South Africa will save about 11 billion rand with this new treatment. FDC is, however, not a new drug, but it has been used before. But poorer countries like South Africa could not be able to afford it before. South Africa will include the FDC in their next tender in April of 2018, and it promises to improve the lives of those living with the disease. Well, that is where we leave it with your news today. I leave you with question time, and today I'm poised with Dr. Makosi Khoza, who resigned from the ruling party today. I'm Alicia Jadi. This is SABC News. Have yourself